Today, we're going to be talking about a common skin condition that affects so many people, including myself. It's called rosacea. We're going to be talking about the symptoms, the triggers, and the best treatment options for how to manage your rosacea. I'm Dr. Hannah Kopelman. I'm here to provide you with skincare advice. I'm going to provide you with honest information on how to keep your skin looking healthy and flawless. If you're new to my channel, don't forget to like, subscribe, and share. Like many other skin conditions, unfortunately, rosacea is just another chronic skin condition that causes your face to look red and irritated. It typically affects the central face. So what that means is you'll usually see rosacea in the cheek area, the forehead, the nose, sometimes even around the brows and the chin. It is so common that it affects over 16 million Americans. That means 1 in every 20 patients has rosacea, so you're not alone. Before we go deeper into rosacea, if you're at home watching this and you're someone who is affected by rosacea, unfortunately, I don't have a magical and permanent cure to treating it. However, I do have recommendations and tips for how to manage it to make it a lot better. If you're someone with rosacea, I'm sure you've experienced how this condition can really wax and wane. So I'm sure there's days when you wake up and you're like, yay, my rosacea is gone. My face is clear. I'm so happy. Unfortunately, there are days when you're going to wake up and your rosacea is flaring. That is just how this condition is. It waxes and wanes. It can be good some days and bad others, but there's ways to control it. So rosacea can affect both men and women. However, it typically affects women who are light-skinned, and it really starts around your 30th birthday. However, you can also see it later in life, so it can start anywhere between your 30s and your 50s. If you're at home watching this and affected by rosacea, then you probably have one of the signs and symptoms I'm about to share with you. I do want to mention the clinical presentation, signs, and symptoms can really vary between person to person, and so can the severity. So I want to go through this list with you because if you're someone with rosacea, it's most likely that you have at least one of the things I'm about to mention. First and foremost, usually you'll have facial redness. We also call this erythema or irritation. You can also get this waxing and waning like I mentioned. So some days it might look good and some days it might be not so good. It's also possible that your face might become very flushed or blushed easily. Now, another very common sign and symptom of rosacea is developing red bumps. Usually they develop in the cheek area or the nose area, and sometimes these are called papules, and sometimes they're even filled with pus, which is when they're called pustules. This is very often misdiagnosed and mistreated as acne. That's why you really need a specialist in order to determine if your condition is rosacea so that you get the proper treatment. Very often, people have visible dilated blood vessels on the surface of their skin. These are also called telangiectasias. When you have rosacea, it's very possible that you also experience some other symptoms like tingling, irritation, itchiness, and just some discomfort. You might even have a burning sensation. With rosacea, it's also possible to get thickening of the skin around your nose. Now, there's one more thing with rosacea I want to mention. It's very possible to get rosacea around the eyes. This is actually called ocular rosacea. You can get this itchy, burning sensation, almost like a grittiness in your eye, and it feels like an eyelash is stuck in there. Now, there is some overlap between ocular rosacea and allergies, so again, something that a specialist really needs to diagnose you with. The exact cause of rosacea is unclear, but what we do know is that there are common stimuli that can trigger it. First and foremost is sun exposure, hot and cold temperatures, hot and cold drinks, hot showers or hot baths. These are all not great for your rosacea. This even includes coffee and hot tea. Also stress, not great for your rosacea as well. Even chocolate, alcohol, spicy foods, sometimes even dairy can trigger your rosacea. Now, don't go crazy here. I'm not telling you to take away all those things out of your diet. In life, my motto is everything in moderation. It might be helpful for you to keep a journal or a little log of what triggers your rosacea. That way you can avoid it. Now, I want to share with you a story about my best friend. About 2 to 3 years ago, around his 30th birthday, he came up to me and he told me he had this red, annoying rash on his face. It would get flaky, and he always knew it was coming on because he would get some tingling around his nose. He asked me what it was. Was he doing something wrong? Was he putting something on his face? Was he eating something that was bad for him? He did notice that it would flare with stress or when he would work out really hard and get hot, like in a hot spin class or a hot yoga class. He also mentioned that some days he would wake up with his skin looking beautiful and clear, and then other days he would know that a flare was coming because he would get that weird sensation, that burning, stinging sensation, and he knew he was about to get a rosacea flare. I explained to him what he had was rosacea, which was likely contributed by a combination of both genetic and environmental factors, which unfortunately is out of our control. But I told him I had ways and tips to help him manage it. So now, when he feels a flare is about to come on, he ramps up his rosacea regimen and he nips it in the butt before it gets worse. So today, I want to help you do the same. It's important to know that treating rosacea is not a one-size-fits-all approach. Because there's such variability in symptoms and signs of how your rosacea might look or appear or feel, there's also variation in how you treat it. And you might have to try different treatment options before you find the one that best suits you. Now, you're probably getting really sick of me telling you this, but sunscreen is so important. We know that sun exposure is one of the number one triggers for rosacea. Therefore, it's so important to start your day with a daily SPF and protect your skin. If you're someone who likes to cover up your rosacea when you go to work or school or go out for the night, I recommend using a foundation that either has a light green or a yellow tint to it. This will blend really well and counteract that erythema or redness on your face. Now, there are some things that I want you to avoid if you have rosacea. First and foremost are obviously those noticeable and obvious triggers that you know are causing your rosacea to be worse. So if you're someone that eats spicy food and your rosacea goes crazy, then maybe try to cut back on the spicy food. But in addition to this, avoid scrubbing the face with astringents, harsh chemical products, harsh exfoliants, acids, or chemical peels. You don't want to cause more irritation to an already red face. Try to stick with the products that are more sensitive and gentle. So for example, I highly recommend using Vanicream Sensitive Face Moisturizer. I use this every single day in my skincare routine. It is very gentle and it will keep your face moist throughout the day. If you're someone who struggles with ocular rosacea, I recommend using artificial eye teardrops and wiping your eyelids with this wipe. You can also use warm water. This will really reduce the inflammation around your eyes. Now let's narrow down on how to best treat the rosacea on your face. This requires a prescription to control it. So first and foremost, try metronidazole, either in a cream or a gel form. The cream might work better for you or the gel might work better for you. You have to try and see. I also recommend azelaic acid, sodium sulfactamide, and sulfur cleansers. Sometimes if your rosacea is really flaring and you just can't get it under control with the topical therapies or you're just not satisfied with how it looks, you might need to try a course of oral antibiotics. Usually this is with doxycycline. You'll be on it for about 2 to 3 months. I know you're probably like 2 to 3 months of antibiotics. That sounds like a really long time, but it really helps your rosacea. Once you come off that course of antibiotics, you want to continue the maintenance with a topical therapy because, as I said, rosacea is a chronic skin condition. And if you just stop all your therapies all at once, your rosacea is just going to come right back. Now, one more thing I want to mention that I have found really helpful in treating rosacea, and it's a more permanent fix. It's an in-office device called a pulsed dye laser, PDL for short. And this is really good for rosacea, for the redness, and if you're someone with those dilated blood vessels on your nose or your cheeks or even your forehead. I've seen this work really well. It's very effective. Sometimes it requires 3 treatments, and it's very long lasting. So that's a wrap. I hope I provided you with tips and guidelines on how to best manage your rosacea. If you have any questions, leave them in the comments below. And don't forget to hit the subscribe button and give this video a thumbs up. I'll see you in the next video.